Pearls. I'm your host, Curry Bordelon. You can join our discussion today by typing your question into the chat box. We will answer as many questions as we can during our 30-minute segment. Today, we're delighted to have Drs. Tidra Smith and Jeremy Jordan join our discussion about pediatric nursing. Welcome to you both.
Thanks for
Thank
having
you
us.
for having us.
Excellent. So as we get started today, I'd like to spend a little time getting to know you a little bit more about how you got into nursing and so forth, and then we'll dive off more into the profession itself. So, Dr. Smith, can you tell us a little bit about yourself, your background, what you do in pediatric nursing?
Yes, thank you so much for having me today on Clinical Pearls. My name is Tidra Smith. I am an associate professor here at the University of Alabama at Birmingham School of Nursing. I have over 20 years of nursing experience. All of that experience has been in pediatrics. I can remember being a young girl, always enjoying being with kids. I was that kid that taught Sunday school class for the younger kids. I was that family member that babysit all the time. So I always kind of knew pediatrics is where I wanted to be. I spent a little bit of time working in a nursing home as a clinical nurse assistant, a certified nurse assistant, but I knew working with geriatrics I enjoyed, but my heart and passion lied with being a pediatric nurse. And I spent a lot of my undergrad education taking those opportunities that presented themselves to work with pediatric patients and their families. So it's just where my passion lies, and I've always kind of known it from the beginning.
Excellent. Thank you so much. It's great to meet you. Dr.
You're
Jordan, can you
welcome.
tell us a little bit about your background and what you do in pediatric nursing?
Yeah, so thank you so much for having me. Again, my name is Jeremy Jordan. I am currently an assistant professor here at the School of Nursing. And nursing is actually a second career for me. I obtained my first degree in healthcare management and worked in clinical trials for a local dermatology practice where I would fill in as a medical assistant. And that's where I really fell in love with patient care. Throughout high school and college, I taught martial arts, specifically developing a program for 3, 4, and 5-year-olds called Tiny Tigers. So I've always loved working with kids, teaching kids, and so I knew I eventually wanted to come back to that. So that kind of blended with that aspect of patient care led me to nursing. So I went back to school to become a nurse and started working in the pediatric intensive care unit at Children's of Alabama in Birmingham. Eventually, after that, went back to school to become a nurse practitioner and became a nurse practitioner in the PICU, or the pediatric ICU at Children's, before coming on as faculty. So I've been a nurse for 10 years and a nurse practitioner for about 7 years.
Excellent. Thank you. Very nice to meet you as well. So I'd like to spend a little time, because both of you mentioned something very important about pediatric nursing and then also nurse practitioner. So let's spend a little bit of time for our audience to kind of get a feeling of the difference in the two. So Dr. Smith, can we talk about pediatric nursing and what that's like at the bedside?
Yes, pediatric nursing is very similar to just in general being a nurse. We take the same undergraduate coursework, typically a bachelor's in science. It can also be an associate degree in nursing. And we take the basic content and all of the coursework that a typical nursing student would take. However, once we get out into practice, we find ourselves focusing on and specializing in pediatric nursing, meaning we're typically employed at a children's hospital or a pediatric primary care setting, some type of clinic setting, traditional or non-traditional clinic setting is where you typically will find a pediatric nurse. The difference between pediatric nursing and pediatric nurse practitioner is that typically with pediatric nursing and nurse practitioner, we're taking care of children and their family. That's the scope of what we're doing. We're specialized to take care of children and their family. We're going to do physical exams, we're going to do assessments, we're going to focus on health promotion and prevention. Where the difference comes into play is that pediatric nurse practitioners can also diagnose. We can also come up with management plans that includes prescribing medication or ordering diagnostic studies for our patients. We can also be the primary care provider for our patients and their families. And so that is one of the major difference of being a pediatric nurse practitioner versus a pediatric nurse. At the thumb foundation, The things we do are very similar. We're focused on the same population. There's some similarities, but pediatric nurse practitioner have that extra layer of education and experience that allows us to have more autonomy to diagnose and manage and be primary care providers.
Thank you so much. That's a great description, and I really appreciate that. And you mentioned something very important in that conversation. You gave us a great a difference in the two of pediatric nursing and pediatric advanced practice. Now, it's my understanding you're a pediatric primary care nurse practitioner. Is that correct? Can you
Yes,
tell us a
that is
little bit
correct.
about that little can you tell us more about that focus in primary care?
So in primary care, I'm really focused on health promotion, health prevention. I can take care of common acute illnesses. I can take care of chronic conditions, but my primary focus is to focus on those well child annual visits, health promotion, health prevention, managing those acute illnesses that are very common in primary care. So for example, some examples of primary care issues would be sore throat, would be someone coming in with a common cold, upper respiratory infection, someone coming in with a simple injury, ankle sprain, something to that effect. I can also manage chronic illnesses. So, for example, asthma. Asthma is a chronic illness, meaning people are diagnosed with asthma and then they tend to have exacerbations or flare up throughout their lives. Where they may see someone specialized to treat their asthma, I can manage it based off the information I get from the specialty person that saw them and diagnosed them and gave them a treatment plan. So those are kind of some of the examples of things I would do as a primary care focused pediatric nurse practitioner.
What type of preparation would you need to become focused as a primary care pediatric nurse practitioner, or even a peds nurse at that?
Preparation for peds nurse, as I stated earlier, is very similar to just being a nurse in general. We go through the same matriculation through school to be able to sit for the NCLEX and take the national certification to become a licensed registered nurse, whether that's associate degree or bachelor's degree. We go through the same process. What we do is extra specialization after we graduate nursing school and pass our NCLEX. We're going to find ourselves working with that population, getting more knowledge related to treating that specific population. So not necessarily more schooling to be a pediatric nurse practitioner, but you're going to work in a specialized area with that population and get more training that's focused on pediatric nursing. And
Excellent. Thank you so much. I'm
as far
sorry,
as the
please go ahead.
primary care piece, while I was in school to be a nurse practitioner, there was extra training that was focused on the primary care population. So a lot of my clinical experiences in nurse practitioner school focused on the primary care aspects, as I explained earlier, health promotion, health prevention, those types of things.
I appreciate that. That extra clarity does help. I really appreciate it. Dr. Jordan, let's
You're
talk a
welcome.
little bit about your acute care background, because you're an acute care nurse practitioner. Can you tell us a little bit about what that environment looks like?
Absolutely, yeah. So in advanced practice pediatrics, we have two specialties, primary care and acute care, like you mentioned. I'm an acute care trained pediatric nurse practitioner. So during my master's program to become a pediatric nurse practitioner, I specialized in acute care. So we start with the foundation of primary care because it's really important that we know the building blocks of pediatric care. So well child growth and development, what kind of skills and things should children be doing as they grow and develop. But then we dive into more acute and critical care. So my training focuses on kids with very complex, chronic, acute, or critical illness or injury. So as an acute care pediatric nurse practitioner, I am trained to care for children who sustain really severe life-threatening injuries, or perhaps even really chronic conditions that are not well managed. So children with really severe asthma that have a really severe asthma exacerbation that require hospitalization or specialized care. So our specialization is also in things like urgent care, emergency department care, and then specialty care, like I mentioned. So a lot of acute care nurse practitioners go into specialties, like, for example, pulmonology, where they care for children with really severe cases of asthma. So really what differentiates our specialties is the type of patient we care for. An acute care trained pediatric nurse practitioner is trained to care for those children who are at really high risk of clinical decompensation. And what we mean by that is at really high risk of getting really sick and have life-threatening or life-limiting illnesses or injuries. So you'll see acute care trained pediatric nurse practitioners work in a variety of settings, emergency rooms, urgent cares, like specialty clinics, as well as in the hospital. So a majority of acute care nurse practitioners work in the hospital, whether that be on a general pediatric floor or with a specialty service, a surgical service, or like me, I work in critical care. So I work in the pediatric intensive care unit.
Thank you. That's very informative, and I appreciate your sharing what type of environments someone with a pediatric acute care certification can potentially function in. And I'd like to continue that environmental discussion. And Tidra, can you talk a little bit about those individuals who are pediatric primary care certified or trained, where you might find them within the healthcare system?
Yes, I can answer that. Typically, a pediatric nurse practitioner that's primary care focused, you will find us in a traditional primary care office where children are coming in for their annual well child visits. So they're coming in to get their immunizations, coming in to get sports physicals, or coming in because they have a common complaint, such as the runny nose that I talked about, or a sore throat, or um, a rash, or something similar to that they're coming in. You can also find us in school-based clinics. There's a lot of school-based health centers where health promotion, health prevention takes place in the school, where kids are able to come get those services, while they're there at the school. You may also find us in specialty clinics because we can focus on chronic health as well. You may find us in specialty clinics such as ENT or pulmonary or neurology. You may find primary care nurse practitioners. You also may find us working in emergency room fast track. And so those fast track emergency rooms are a component of the emergency room, maybe fast track, where patients that are coming in with typical primary care complaints, they may move them to the fast track area where a primary care nurse practitioner may take care of them.
Excellent, thank you. So one of the things we want to talk about is also understanding the population a little bit more. So we've talked about some of the environments that you'll be in and so forth. So what is that life across that lifespan? What age spans are we looking at for our pediatric patients, Dr. Jordan?
Yeah, so that's a really great question, and a common question that we get, especially for individuals looking to become pediatric nurse practitioners. So generally what is referred to as a pediatric patient is any type of patient that would benefit from a pediatric provider. So different professional organizations have set different standards, as well as individual states may regulate the type of practice that nurse practitioners and physicians can practice. But our professional organization, the National Association of Pediatric Nurses, defines a pediatric patient as an individual from birth to young adult. So they don't put a specific age range or an end of when you're no longer a pediatric patient. And the reason for this is because there are specific diagnoses where children are living much longer. For example, cystic fibrosis. Children used to not survive past being a teenager, and now they're surviving and with advancements in treatment and care and doing much better for much more extended periods of time. So that patient may actually see a pediatric nurse practitioner beyond the age of 18 or 19, provided that's within their scope of practice, depending on the state. So there is no set age range, but generally one could say anywhere from birth to young adulthood, so in the early 20s. And for example, in my practice as a nurse practitioner in the ICU, I care for patients who sometimes are up to the age of 25, 26 years old, because they have a pediatric diagnosis, something like Duchenne's muscular dystrophy, for example. That I say child, but that individual has had their care at a pediatric facility their entire life with multiple pediatric specialties, and that person is best served by a pediatric provider. So there's no set age where you kind of age out of that pediatric population, but it's really all kind of based on your need. But now that we're getting really good at caring for individuals for much longer periods of time, we're working on transitioning them to adult providers. So for example, now there are adult providers who are experts in cystic fibrosis or CF. So we are now able to transition those patients to adult providers for the rest of their lives for ongoing care. But that's a great question and a common question.
Excellent, thank you. So, you seem very passionate about this population. There seems to be a lot of enjoyment caring for a group, such a vulnerable population, such as pediatric acute care patients. Can you talk to us and our listeners or our viewers, what type of characteristics, how did you know I want to be a pediatric acute care nurse practitioner? So, Jeremy, how did you know that that's my path I wanted? What characteristics do you have to be able to be successful in that population?
Yeah, so that's a great question. I knew that I wanted to work with children. Like I mentioned previously, I worked with kids in high school and college. So I really enjoyed working with kids. And I'll be very honest, I was very anxious to start my first nursing job in the pediatric intensive care unit because these children are very sick. And it can be quite sad and daunting kind of career to take. However, what kind of inspired me to remain in pediatrics and how I really fell in love with it is this ability of kids to bounce back. Kids have such a will to live and a vigor for life that they will fight and they will continue to fight in order to get better because that's what they want. They want to get better. They want to get out of the hospital. And they will do anything that you ask them to do to get themselves better so that they can get out of the hospital. So while it is at times very sad, it's probably one of the most rewarding specialties for me because I get to see kids come in with really severe injuries or illnesses, and they bounce back. They do better. They want to get better. So they fight and they work really hard. They do the things that we ask them to do to get better, and we get to see them grow and flourish. And so in pediatrics, you really have to want to be there and you have to want to care for kids. Working in pediatrics is not a specialty that you can go into just because there happens to be a job opening in it. Those type of individuals don't tend to be successful in pediatric nursing. It's individuals that want to be there, want to help kids, and want to see them get better that do really well in that environment. And so that is what's really inspiring to me, is to see these kids go through pretty traumatic illnesses and injuries, but bounce back and do very well.
Thank you, and that's what a great message, and I appreciate your sharing the storyline because that could potentially inspire others to not be afraid. It can be intimidating. It certainly can be scary to be in that environment where that seemingly endless suffering that some patients might encounter. That there is an opportunity for improvement. There is that opportunity for advancement past that disease process. And I'd like to share the same question with Tidra. Tidra, how did you know that I want to be in primary care nurse practitioner? What characteristic that you carried that carried you through that process?
Thank you. I share a lot of the same sentiments as Jeremy. I had a strong passion for it. It was something that brought me joy. I discovered early on that working with children, taking care of the children, brought me joy. When I was in nursing school, undergraduate nursing school, I longed to be with the pediatric population. Any opportunity I had, I wanted to work with a pediatric population. My first nursing role was actually in the emergency department at Children's of Alabama, and I fell in love with taking care of children and their families, being able to see how resilient they are and how they desire to get better and being able to educate. I've always loved educating, and I feel like with the right education, the right coaching, the right cheering them on, coaching, motivation will help them be successful and help them succeed in life. And every child deserves to have a healthy life. Every child deserves access to care. And I've always just enjoyed being able to provide that access, being able to educate the families on how to help their children have a healthy lifestyle behavior. That's just something that's always brought me joy. It continues to bring me joy to this day. I'm very passionate about it, and I think anyone considering pediatrics has to have a passion for it. It's not always easy. Every day is not great. There are some days you're going to be really upset with the family because they're not doing the things you've educated them on. But I always find joy in redirecting because I see the smile on children's face. I see them getting better. I see them desiring to get better. So you have to have that compassion. You have to have that empathy. You have to have the desire to help the family as well, because that child is going to go home with their caregiver, with their loved ones, with their mom and dad, whoever is taking care of them. You're going to have to be willing to educate them as well and to show your compassion and empathy toward them as well. So it's definitely something that you have to search long and hard in your heart to determine that this is something I'm passionate about. This is I understand the ramifications of it. And every day, like I said, is not a good day. Sometimes we do have children that die, and those are really, really hard days. But the sum total of my time working with pediatric population has brought me much joy.
Thank you, and I appreciate that inspiring message because that certainly can motivate some of our viewers who might be interested in the pediatric population to care for, of
Mhm.
care. So, thank you so much. So, I'd like to move in our segment into the next phase where we kind of get an idea of what your daily life is in the clinical setting. So, teacher, can you tell us in your clinical practice time and when you're caring for patients and families and caregivers, tell us about what a normal day would look like for you. And if you have any big challenges that you see quite a bit, how do you overcome those challenges and how do you keep that motivation?
I'll give you an example from working in a traditional primary care office. I spent a lot of time in this setting. So typically, your patients are going to come in, they're going to get their height and weight and get placed in a room. And then I would be able to review their chart to determine, what immunizations do they need, if any, what is their chief complaint, why are they here today, who's in the room with them today, what caregiver is there with them, what concerns may they have before I go in the room. I just usually always like to do a general overview so that I know, before I walk in to get a general sense of the patient when I can. There's not always a chart that I can review, but a lot of the times in primary care, these are patients that this is their primary care home. This is where they come anytime they're sick, anytime they need well child exams. So you get very familiar with the patients, you get very familiar with their caregivers, and so you build that trust and relationship with them. So typically, of course, going in, getting a very thorough history, getting a very detailed exam on the patient, getting an examination to determine, what illness they may have or, any key findings to help me with their diagnosis and management options. Some of the issues that I tend to see a lot is going to be the affordability of medication. That's one of the greatest challenges that I've seen here in the state of Alabama. The majority of children have some type of insurance. There's usually going to be Medicaid, all kids, or private insurance. So the majority of kids here in the state are insured. So getting insurance is not the issue. The issue is being able to afford the medications that we're prescribing or the resources that we think they should have. A lot of children in the area that I took care of in the primary care setting, it was a lower socioeconomic area, so there were lots of transportation issues. There were lots of unsafe environments. So, for example, me giving them a plan to do some outdoor exercise because maybe I noticed that they're a little bit overweight. That's really not feasible for them to go outside and do that because they live in an unsafe area. So I have to kind of think about the whole aspect of my patient, their environmental, all of those social determinants of health, so that I can understand um, and modify their management plan because it does me no good to do a management plan that they can obtain that is not reasonable for them. So very individualized care in primary care is important. So determining, what they need, what resources they have access to, uh, having a motivational interviewing session with them. Are they even ready for the change? It's important. So I encounter a lot of those kind of setbacks where they really want to do better. They want to follow the management plan, they just don't have the resources to be able to do that, including transportation, including ability to afford the medications. So I spent a lot of time doing that in the traditional primary care setting, kind of figuring out, you know, what can they afford, what resources are reasonable given their environment and where they live and their caregiver support.
Thank you. And one of the things that you mentioned in within your conversation is some of the common stressors and some of the common things that can be challenges
Mhm.
for you. And we've certainly been challenged over the last few years with COVID as well, adding on top of previous challenges and ongoing issues. How do you deal with burnout? How do you stay motivated, wanting to stay in that field, and moving past some of these big barriers within your clinical space?
Personally, I enjoy getting outdoors. Getting outdoors is very important to me, whether it's taking a walk, whether it's taking my son to the playground, just getting out in the fresh air really usually helps me refocus. I know it's been really challenging, as you stated, because of COVID. The census has been high, the severity of the patients have been high, and so it's very easy to get burnout. But I also remember the reason behind why I do what I do. You know, it's helping children recover. That's what I enjoy doing at the end of the day. And I understand it's going to be stressful sometimes. I understand some days are going to be not as good as others. I understand, some children are not going to get better. But I remember my reasoning why getting in exercise, eating healthy as much as I can are things that I do to try to prevent that burnout. Spending time with my friends and my family, taking a break from the screen sometimes, taking a break from getting on social media and things of that nature are all things that I do to kind of help with that burnout. Taking a day off work when I can. It's not always feasible, but when I can take a day off, taking that day off. A lot of people hesitate taking vacation days, but vacation days are important. Even if it's a staycation and you just stay at home, taking that mental health break is very important. And those are things that I do to kind of help when I'm feeling a little bit of burnout.
Thank you. That's so important. Taking care of yourself and resetting yourself. So I'd like to briefly ask Jeremy the same question about what is tell us briefly describe what your normal day is like. What is a normal day for you, and what are some of the common challenges that you encounter?
Yeah, absolutely. So, in the pediatric ICU where I practice, my day generally starts by reviewing, similar to Dr. Smith's, reviewing the charts and the information that we have about our patients that are on our service, and going to see those patients, doing a physical exam, speaking with the other care providers, so that bedside nurse, the respiratory therapist who's cared for that patient, the social worker, child life therapist, the entire team that helps take care of those patients, getting information from them about how the child is doing, and then developing a plan of care. And so I do that for each of my patients. And then we round as a multidisciplinary team at each patient that's on our service. So we go from one patient to the next, discuss their current treatment plan, any adjustments we need to make in the treatment plan, as well as address any social or family needs. So where I work, I frequently tell people we actually have two patients. We have the patient who's there in the bed, the child, and then the family. The family is a really important aspect of the healthcare team. But these families, understandably, are experiencing probably one of the scariest and probably one of the worst times in their life. Their child is in the intensive care unit, who's very, very sick. They're very scared. They don't always fully understand what's going on because, as you can imagine, the ICU is a very complex environment. So part of my day is also spent with that family, talking to them about ways that they can take care of themselves. So coming out of the unit, telling them it's okay to leave the bedside of their child for a moment, to even do simple things like go for a walk, go call family members, take a shower and take care of yourself, because they need to be prepared and ready to take care of their child when their child is better, and leaves the hospital. So that's actually one of the most challenging things, is getting parents to care for themselves, because parents are very obviously and importantly very focused on helping their child get better. They continually ask, what do we need to do? What can I do to help? How can we get my child better? And we work as a multidisciplinary team to get that child better. So it is that family member's job, that parent's job, to take care of themselves so that they can be ready to take care of their child when their child gets better.
You know, and that environment does lend itself to an enormous amount of stress. There's a lot of stress, and I'm sure burnout as well. You know, Tidra mentioned one of the ways that she cares for herself and helps others care for themselves. So, Jeremy, what do you do to help mitigate burnout and to really help reset yourself?
Yeah, so that's a great question. In the ICU or in the inpatient setting, like I mentioned, we're a healthcare team, so we work together. There's a lot of other healthcare individuals, so I frequently find myself relying a lot on the physicians that I work with, the nurses that I work with, respiratory therapists, and having another healthcare professional to talk to about the things that you're going through, because sometimes what you see, you don't want to go and share that with your spouse or your kids at home, because they can be very traumatizing. So it's not always something you can talk about with your family um, outside of work. So really creating those bonds with your coworkers is really, really important, and utilizing any resources that's offered by the healthcare facility that you work in is also really important. So like Dr. Smith mentioned, taking the time to step away from work, to step away from the bedside, to take care of yourself, because you know, just like we're teaching parents that they have to take care of themselves to get ready to care for their child, we have to take care of ourselves as nurses and as healthcare professionals, because if we're not healthy and we're not capable of caring for the children that need our help, then who will be? Right? So it's really important that we do everything that we can to avoid burnout. And for me personally, doing things like exercising, traveling pre-COVID, and now slowly getting back into it, being able to travel a little bit, is something that really helps me to kind of step out of the environment and the world that I'm in, and kind of get out of my own head. Allows me to kind of reset and come back with a fresh set of eyes, and kind of some renewed energy, and to help start to take care of these kids again, because it is very taxing, not only emotionally but also very physically. So caring for ourselves physically is also really, really important. Eating well, but also realizing that it's okay sometimes to, binge watch that Netflix show for, an hour or two on the weekends, because we need that break. Working in the ICU, it's obviously a very challenging environment. So taking that break, that little escape, whether it's reading, exercising, watching TV, yoga, whatever it may be, those little escapes add up and really help kind of reset and refresh yourself before you go back to work.
Absolutely, and that mental reset can be so beneficial to long term success within that career. So we only have a couple of minutes left, and what I want to do is move through some of the resources. So, teacher, can you share with us what if someone's really interested to learn more about pediatric nursing or advanced practice pediatric nursing? Do you have some resources that we can share with our viewers?
Yes. So just general pediatric nursing, the Society of Pediatric Nursing, so SPN, has a wealth of information. There's a journal associated with it, lots of great resources on pediatric nursing, ways that you can expand your knowledge set for pediatric nursing. So this is a go-to for me, especially when I was just starting out as a nurse. I wanted to learn more about, the pediatric world and increase my education related to pediatrics. Another resource would be the National Association of Pediatric Nurse Practitioners. If you're interested in being a pediatric nurse practitioner, there's a lot of information and resources, continuing education information about being a pediatric nurse, some of our position statements, and other ways you can get involved. And there's also the Journal of Pediatric Healthcare that's associated with being a member. There's also the pediatric nursing, the Institute of Pediatric Nursing as well. And then there's the Pediatric Nursing Certification Board, where especially once you complete nurse practitioner education, you can be certified as a pediatric nurse practitioner, primary care, or acute care. There is also a certified pediatric nursing. So before you even attend nurse practitioner school, if you wanted to be certified in pediatric nursing, you can go to PNCB as well and see the information requirements needed to be able to sit for the exam to be a certified pediatric nurse. So those are just some of the resources. So remember, Society of Pediatric Nursing, SPN, NAPNAP, which is the National Association of Pediatric Nursing, as well as Pediatric Nursing Certification Board, PNCB. Those are our
Thank
three
you.
major resources.
Excellent, thank you. And that's very important resources for those that might be interested. So teacher, we're going to close out here. So teacher, any final takeaway, any final thought you'd like to leave with our viewers who might be interested in pediatric or pediatric advanced practice?
I would say follow your passion, follow your heart. Pediatric nursing requires a special skill set and not necessarily a physical skill set, but your soft skills are very important in pediatrics because not only are you taking care of the patient, you're also taking care of the patient's caregiver. So it's important to make sure it's something that you're passionate about, something that brings you joy, because you have to exude compassion, empathy, a lot of case management when you're taking care of the pediatric population. And
Thank you. I appreciate
don't hesitate to seek out information. Don't hesitate to reach out to shadow because it is very different than taking care of the adult population. So I encourage anyone that's interested to shadow if you can and to use all of those resources I listed to get all the information you can about being a pediatric nurse or pediatric nurse practitioner.
Excellent, thank you. And Jeremy, any final thoughts you'd like to leave anybody interested in pediatric nursing and or acute care nursing?
Yeah, so thank you again so much for having us. And one thing that I would say, anybody that's interested in becoming a nurse or is already a nurse and interested in going into pediatrics is similar to what Dr. Smith said, don't hesitate to reach out and look for an opportunity to shadow. Because like I mentioned earlier, everyone that works in pediatrics wants to be there and loves their jobs and loves what they do. So any pediatric healthcare provider, nurse practitioner that you meet will be more than happy to talk to you about their position, their role, and what they do. All of the major children's hospitals around the country all have shadowing and volunteer options so that you can go and see what it's like to be a pediatric nurse or nurse practitioner. So utilize those resources and, just connect with a pediatric provider because if you give us the opportunity, we will tell you our life story. We will tell you why we love working with kids and give it a shot. If you have any kind of inclination and thought that you may want to work with kids, try it. Come see if it's going to be for you. And you'll find out whether that's something that works for you or not. But it could be, that first step into a really rewarding, lifetime career caring for kids. So don't be afraid to take that first step and shadow a nurse or a nurse practitioner to see if it's for you. Because I know plenty of nurses and nurse practitioners who work in pediatrics who, while they were in nursing school, had no desire to work with kids until they rotated through a pediatric setting or shadowed a pediatric provider and got to work with kids and then fell in love with it. So give it an opportunity and you can see if it's for you, because if you want to be a pediatric provider, we would love to have you.
Excellent. Thank you so much for sharing that. And, thank you both for being here today. We're very excited to hear your story. And it looks like, we're out of time, but we could stay here for a lot longer to hear about your very inspirational stories. But this was such an interesting discussion. Thank you so much for being with us today. We really appreciate you sharing your story. And thank you all for joining us as viewers. And we appreciate your encouragement and certainly your questions. We appreciate your time. Thank you again. And we look forward to seeing you next time on Clinical Pearls.
If you liked this video, please remember to like and subscribe and click the bell icon to get instant notifications when we release new videos. Thanks for watching.